right. Hi, everyone. This is Dr. Dana Rockey coming to you today with another interview with somebody that's prominent in the world of sleep. And as many of you know, I'm a general dentist that promotes an integrative type of approach to dentistry, or a wellness-based approach. And a big part of that is inflammation management with periodontal disease, is nutrition. We bring that into the dental practice. And most recently, I started a complete new dental practice focusing exclusively on dental sleep medicine, and along with that, the temporomandibular joint disorder issues. I have found somebody that is very experienced in this world, and I'd like to introduce you to Julia Worrall. And I read on your bio that you've been a critical care nurse for 20 years. Well, we have something in common. I'm actually married to one. 30 years, critical care, intensive care, trauma, and nurses are the very best. So that says something about you, as well as the educational director for the Foundation of Airway Health. Maybe you can tell me a little bit more about that. Julia has presented her findings on sleep to the National Commission on Correctional Health and Care, and continues to push for more comprehensive sleep programs for first responders and the public in general. So thank you very much for spending some time with me today. On your website, I love this quote: "Sleep is one of the most underrated tools we have to stay healthy." I love that. And in my screening of people here in the dental practice, I still get people wanting to know why me as a dentist is even worrying about sleep. Or why don't you tell us a little bit about how you got into that, a little bit about yourself and what you do?
Thank you so much for that introduction. I found myself in the emergency department working with patients you'd see day after day after day, and always wondering why. Why do we say, well, they're at that age? Or why do we say there's certain types of people that have a certain look and they end up with this metabolic disorders? Or we're seeing people younger and younger having heart attacks. We're seeing young people having complete breakdowns, anxiety, depression, suicides. And you work in this environment and you want to feel like you're helping, but it does get overwhelming sometimes because they just keep coming and we're not getting on top of it. And you would think with all the science and all the knowledge that's out there, we would be way ahead of the curve. So it was a shock to me. And you could probably identify with this with your wife. Like, to be a critical care nurse, you need to take so many certifications. And you have to do them over and over and over for trauma, for ACLS, and your BLS that people take, and critical care certificate. Like, there's just so much knowledge you're taking all the time, and so you feel pretty confident that you know what to do to help people. But it was at a visit one time to a dentist's office where I saw a poster that said, "Ask your dental provider about sleep apnea." And sleep apnea was something I'd heard about only in the sense of, I thought it was truckers. You hear about truck drivers having it. I heard about it in terms of a CPAP, but it wasn't something that I was really familiar with. We didn't hardly ever address that in the hospital. So I was really surprised to see that the dentist had that poster, almost to the point where I was kind of like annoyed. Like, you're going to be talking to people about a medical condition, but you're a dentist, and that's not in your realm, or so I thought. And so when I asked the dentist about it, it just happened that this dentist is somebody who taught all over the world, and he invited me to come to some of his courses. Well, I got to tell you, when I sat there at that course, my mouth was just like on the table. First of all, I couldn't believe the level of knowledge that these dentists had about sleep and about how it affected the entire body and all the comorbid conditions. These were things, they were connecting dots to things that I never even heard of before. And I started to realize all these patients that we're treating were completely ignoring sleep, as if it's not even a factor in their atrial fibrillation, in their high blood pressure, in their uncontrolled sugars, as if it's not a factor. And so I started taking every course I could, and when I started to connect the dots that sleep isn't something you can talk somebody into or talk them out of. It's so physiological. And so when you start to understand how the structure of our airway, before, as a nurse, I'm thinking airway, I take my stethoscope, I listen to your chest, and I'm doing an airway assessment. It never occurred to me to look up their nostrils, to look in their mouth, to see where their tongue is sitting, to look at any inflammation around it. It never occurred to me to look at that. And now here was this world of dentistry where that's all they look at is this part right here, and drawing the connections between a tongue being tethered, between the inability to breathe through your nose, between the teeth being all crowded in the mouth, that these were all signs that you could easily identify and recognize that there was an airway issue. And if there's an airway issue, there's going to be a sleep issue. So for me, it was just like a light bulb went off, and I haven't been able to look back since. I can't work in that environment where the veil is still there without speaking up and telling people. So that's a challenge for my coworkers. It's changed my life, it's changed my practice, it's changed my entire focus in addressing health and wellness with people. Is first, let's do our ABCs. Our airway, our breathing, circulation. Let's make sure your airway is sound before we go any further.
It sounds like your epiphany kind of came with the reasoning that there's a disconnect. You were talking about medical comorbidities and kind of a sleep issue or an airway issue. There's a disconnect. And to me, the missing piece is education. I have a very nice endocrinologist, and of course, that's a significant issue with sleep apnea in the endocrinology world. And he said to me, gosh, we are now working together. And he said to me at the beginning, when I send them off for a sleep study, as in somewhere else, they get lost in the system. They don't get any education. They come back, they're CPAP failures or whatever, and they just fall through the cracks. And I'm still ending up with, after all that rigmarole, I'm still ending up with untreated patients. So given what you said, and the reason that I started my dental practice is primarily to get the educational piece out. And I hear those words in you.
Right. And so that's basically what I do all day long. And I spend equal amounts of time with the sleep doctors in the medical world as I do with the dental sleep doctors in the dental world. The number one issue between both is patient education and the hand holding that needs to take place. And once you understand what a lifetime for some people, or at least several years of not enough oxygen getting to the brain every night, and you start to understand how that damages different parts of the brain, you begin to understand why these patients have such a difficult time motivating themselves to seek treatment and then following through on the treatment that's prescribed. So it becomes a very supportive environment. We have to get the family on board to be supportive and encouraging. We have to be patient, and we have to help the patient themselves to give themselves time to adjust to this new situation and new concepts. So you're absolutely right, and I hear it from everybody. I hear it even from the sleep doctors who order the CPAP, that once that's done, it's kind of out of their hands, and there's a frustration on how do we get more people to be compliant. And then on the other hand, the frustration I feel at times is that the knowledge is not there among the medical providers to understand the role of oral appliances, palatal expansion, advanced jaw advancements, and things like this that can help patients as well. And because they're not familiar with it, and they haven't taken the time to become confident in it, they don't even offer it as a solution to their patients. And so these poor patients are like, what do you mean I could have had a choice? Like, if I hate the machine and I don't want to wear the machine, how come nobody told me I could have gone and seen a dental sleep doctor and they could have done something else for me? So education among providers, creating that collaboration to respect the value that each one brings to this, and then education for the patients and their families to help them push through the challenges in order to reap the huge benefits they'll feel once, their brain is actually functioning and they're getting restorative sleep.
You very eloquently put that. The biggest issue here is the educational disconnect on all different fronts. Another thing I'd like to say, and thank you for, is calling out dentists as what I refer to as first responders. Yes, we work here, but we're really should be taking blood pressures and pulses and comprehensive medical histories and updating those medical histories and having some knowledge of inflammation, which I know is a big part of your work. That's what we're here for. Airway issues are front and center with what we have to do. We look in the mouth. every day. And that's what I'm doing. So thank you so much for doing that. To me, inflammation is the root cause to most chronic disease. And that actually comes from our good friend, Dr. Sears. Or put it another way, inflammation plays a role in nearly all disease. So here we have something, as in sleep apnea or breathing disordered sleep, whatever you want to call it, on a broader term, that is inflammatory producing. Tell me about what your concerns are. Why is that such a big deal? And how do you address that?
If you look at all the science that's out there, and you listen to Mark Hyman and Joseph Mercola and all the
I love both of those guys.
Okay, so yeah, they're trying to, and they have been for years, to trumpet to everybody to understand inflammation is the issue. The endothelial dysfunction that arises from sleep apnea, the damage to the lining of your arteries, and everybody fixated on fats and sugars, and all of these things can be inflammatory. However, sleep apnea, independently of diet and nutrition and all of these things, has a huge effect on systemic inflammation, making somebody become acidotic and creating just general dysfunction in every organ. Like, is there literally any part of our body that can thrive in a hypoxic environment?
No.
All tissue needs oxygen, right? However, there is a part of our body that potentially could thrive in a hypoxic environment, and that would be cancer. That would be tumor cells, right? It thrives in that hypoxic acidic environment. So now you're looking at, it might be initially starting with a general annoyance to a bed partner because you're snoring, but now it becomes your body systemically inflamed. It's affecting your mentation and how you think about things. You're starting to have struggles with word finding and your memory. Your blood sugars are starting to go out of control. Your high blood pressure. You've got erectile dysfunction, depression, anxiety, becomes insomnia. I mean, it's just this cascade of events that literally affects absolutely every function in your body. And we have spent so much time and effort on nutrition and exercise, and both for valid reasons. But I feel like the reason we've been able to attack those so diligently is because those are things that occur during our waking hours, where I can actually answer a question you're asking me. I can tell you, no, I don't exercise every day. Yes, I do take the stairs. I do eat carbs. I don't, we can answer those questions, and we have dissected those two to death. The issue becomes, now you're going to ask me questions or try to create a plan for me based on something that happens when my eyes are closed and I'm completely unconscious, unaware. Well, that's a lot trickier now to convince somebody that when you close your eyes and you're in your most vulnerable state, naked, in your bed, behind closed doors, here's what's happening to you. I mean, that's creating the inflammation in your body is really hard for people to wrap their heads around. But unless we help them control and dampen that inflammation, then their nighttime hours will continually sabotage all their best efforts that are occurring during the daytime.
I like to think of it in a simplistic way that it's the cortisol, a massive outdosing of cortisol to do the arousal phase is incredibly inflammatory and damaging. I mean, fight, flight, going on chronically all night long, it just could not be good for us. And I kind of use that to describe and to help teach and educate people here. Some days I come in my office, I close the door and bang my head against the door because they just don't get it. But
conversely, if you are chronically stressed during the day, it will impact your sleep at night. So it's like a chicken and egg thing, because sleep apnea is highly correlated among law enforcement, and they're not overweight, and they are in physical shape, and those things. But the hypervigilant state that they're in creates damage, which then in turn affects their sleep. So you're right. It's the chronic activation of stress, even in utero for the developing child. I mean, so it goes. Yes, sorry. I know I'm preaching to the choir here, but
no, I'm loving it. What I'm hearing, it's fabulous. And you're talking about 70% of people with obstructive sleep apnea, and you talk about mouth breathing. For many years, I would look at patients that would have inflamed gingival tissues in the front and say, "Oh, that's a mouth breather. Let's make sure you focus there a little bit harder on your oral hygiene and whatnot, something like that, not really realizing that that was an issue probably with sleep at night more important than actually their gingival tissue. So I know it seems as though you make a pretty significant point on that. Is that correct?
Absolutely. I mean, the minute you're breathing through your mouth, you are sympathetically activated. So mouth breathing on its own creates inflammation. And we weren't designed to breathe through our mouth. We're designed to eat through our mouth and breathe through our nose. When you're going to be helping somebody with sleep, here's another kind of pet peeve I have is a provider prescribing a nasal pillow CPAP or an oral appliance without checking to see that the patient's nose is functioning first. Can the patient breathe through their nose? If they can't, then they're going to have increased stress response to whatever you've prescribed, and their compliance will go down. The simple act of closing the lips and breathing through the nose also helps to reshape some of that structure. There was a study done on children with cleft palate, and they realized that if all they did was made sure that the nares stayed patent, then the cleft would close on its own. The face would continue to grow and it would close. And all they had to do was stitch the skin at the end. But when they used appliances that actually latched into the nose to create a palate to feed the babies, when they used those, the face stopped growing forward and the function at the end, even after the surgery, was never as good. The power of nasal breathing to decrease inflammation, to induce calm, to manage your metabolic rate, to manage your mood and anxiety, sympathetic, parasympathetic systems, all starts with your ability to breathe through your nose. And I'm sure you've seen once that veil's lifted and you get it, all you see everywhere are chronically inflamed mouth breathing people.
How do you retrain clients to think about breathing through their nose, or what do you do there?
So I start with a functional cranial nerve exam to look at how their nerves function and interact with one another. Are they communicating one to another, and are they sequencing properly for optimal function to occur? So I do that first, and then the patient they can identify and see where the issue is, rather than me just saying, they get to experience it for themselves. And then we use various techniques to turn that olfactory nerve back on. We take some essential oil, put it on a Q-tip, and we start going up to the back of the nose. We're trying to trigger a sneeze reflex, which we are born with. Most people, you can put something up their nose and they're not going to sneeze because that nose is basically sitting dormant. It's not functioning. And these are the ones who have the allergies or chronic sinus issues, and they're just full of gunk and pressure. So once they get that turned on and they experience that, it's so almost euphoric because you get this rush of air and flow happening to your brain where it wasn't getting it before. So we spend time where it doesn't take much time and it's very simple and easy to do. But the effect of when they feel their nose turned on versus when it's not, then we can start on positioning the tongue up into the space it needs to be, because if that tongue is up, the patient cannot breathe through the mouth. So before we do that, we want to make sure they can breathe through their nose, and we'll do we'll use tape, we'll tape the mouth, and we'll see how long a person can go breathing through their nose, performing, some mild activities to ensure that they've got good flow and they're not anxious about it. So we just go step by step through the function of the face and the cranial nerves.
I presume that you work with children too. Dr. Sears, of course, being a pediatrician, really is focusing on, and his brain health book is out right now, principally talking about late stage issues and how to prevent that. But I have seen some children here with breathing issues, clearly mouth breathers, clearly very vaulted, narrow palates, and they come in basically with behavioral disorders. And so I assume you work with children and starting early to move forward, right?
Absolutely. And the change is like overnight. It takes a few weeks to kind of get them on the program and it going smoothly. But once that change kicks in, they are completely different children. And that's something I'm very passionate about because when I was working, in the Department of Corrections, and you start to realize how many juvenile detention centers there are and how many children are being housed from the age of 5 to 21. And that breaks my heart to see that. But to think that a child is so out of control or the parents don't know how to manage, and when you look at the path that they end up on of medication and being labeled and anxiety and depression and drugs and it grows from there. And if we can help parents from very early to not feel ashamed to speak up and say that I'm struggling. And if they only knew how many other parents were struggling too, and looking at working with the parents from very early on simple things to implement with their children, that if your child can breathe well, if they can sleep well, then they can perform well and behave well. Can you roll it back? Yes. Is it ever too late? No, it's never too late to get on top of that and correct it. And it's so worth it, especially when you think about the numbers that we're seeing with kids nowadays. They need us to step up and speak out and say, it's not your fault. And if we knew back then that you were struggling and the reason you were hyper all day and the reason why it seemed that you never wanted to go to sleep was because when you did go to sleep and that cortisol that you spoke about kicks in and gives you like that shot of adrenaline, you woke up in a panic and in fear, and to you it was a nightmare or it was a night terror, or you got up and or you wet the bed. Like to you it was this, but in actuality it was an airway and sleep disorder, and we didn't know. So now we know. Let's see what we can do to fix it. The alternative is just not acceptable.
Well, thank heavens for people like you that are going to take the stigma out of it and get maybe to the core problem, get to the organic problem and solve that, and just think of all the pain and misery and struggle that we might be able to relieve. I'm really impressed. You seem to make a big deal of first responders. You already talked about that. Maybe military, public safety people struggling with sleeping issues. And you kind of explained why at the beginning regarding a stress-driven or a cortisol-driven daytime life. But we've got military, we've got people falling asleep, we've got train drivers falling asleep and whatnot. What do you have to say about that? That's a big problem, is it not?
It is. And I think what breaks my heart is that somebody's dedicated their whole life to protecting other people, and we're not doing a great job of protecting them. The expectation we place on people to manage with 4 hours of sleep, and they should be strong enough because they're military, or they can go and do a double shift, triple shift because we need them to be there. But the toll that it's taking on them is brutal, and on them and their families. And we see that reflected in suicide rates, and we see that effect when they retire. How many years past retirement most of them live? Not many make it past 5 years, and that's a shame. The numbers are just too high for us to look the other way. Suicide rates among military, yes, police officers, and correctional officers. And oddly enough, correctional officers are double the suicide rate of military returning from active duty. And you're like, that just should not be. So it's not something we talk about a lot, but clearly there are current initiatives right now. There's a presidential initiative to look at suicide rates and how can we impact it. And what I would say to that is, invariably, when you hear of somebody committing suicide, the family will report that the patient started by having trouble sleeping. And you can see that 6 months, at least 6 months ahead of time. They were struggling with sleep. Their schedule was all mixed up, or they weren't getting enough sleep. And they may be on a sleeping pill or two, and it doesn't do the trick because we're not addressing the underlying issues there. But when you're dealing with mental health, you have to go back and address the sleep, because two people in the very same scenario, one person gets to the point of suicide, the other doesn't. One person has resilience, the other one doesn't. What is the difference? It's not training. It's not personal willpower. It is physiological. One person might have an airway issue or a sleep disorder and the other one doesn't. So that person can go to sleep each night the brain is able to manage and deal with and put away whatever experiences that you've had through the day, and they wake up refreshed, ready to go. The other one maybe is not getting oxygen all night. They're snoring, their oxygen's dropping, their brain, instead of restoring and healing, is just struggling to stay alive. So they wake up with a deficit in the morning and they go back to work and do it all over again. So no, I'm very passionate about highlighting this, and I am happy to see some of this coming to the awareness of some of the officials, because the whole thing about being able to function on 4 hours, they're kind of starting to put that aside in different organizations. But we still have a long way to go to help people realize that being chronically exhausted is not actually a badge of honor. There's nothing shameful in saying you're tired and needing to sleep. We see law enforcement fall asleep in their car, and somebody will take a picture of that and post it on social media. They lose their job, or they're mocked or criticized for that, rather than seeing that as a sign that that person needs help and offering them help. There's clearly a lot of work that needs to be done, but valuing sleep as part of our performance has to start to become the go-to for these organizations.
Well, you touched on something just a minute ago. Sleep is mechanical and chemical, and you kind of explained exactly what it is, and it varies from person to person. That's the issue. Let's get into a little bit of lifestyle and nutrition, and you also talk about vitamin D levels. I think vitamin D levels are critical for the immune system, critical for body function. Would you take your clients and work with them and suggest lifestyle and nutritional changes also?
Absolutely. Absolutely. One of the first things I want them to get checked is their vitamin D level, for sure. That's the starting point. Your vitamin D, or hormone D, or whatever. I often say I wish they came up with a much more interesting name for it, so people would say, "Oh, I have a factor D something deficiency." It sounds more exciting, because when you say vitamin D, it's as if it's minimized in people's minds. So you have to go through this whole thing of trying to get them to understand how important it is that every cell in your body has a vitamin D receptor. And so if you're low in vitamin D, you are not going to function properly. If the mom is low in vitamin D and it throws off her biome, and the baby's growing in that environment, that baby's already going to be born exponentially lower in vitamin D than the mother. The tissue, it's going to affect the tissues in the back of their nose, which is going to make it harder for them to breathe through their nose and start to lead them on the path becoming a mouth breather. There's just so many things that are intertwined with it that, in my opinion, you cannot help somebody with their sleep if you don't have a grasp of what their vitamin D level is. It triggers REM. So if they're low in D, they're not going to get restorative. If they're bruxing or grinding their teeth, you got to look at vitamin D, because why are those muscles firing when they should be paralyzed? Yeah, having a good grasp of vitamin D's function in the body, I think, is a must for anybody dealing with sleep.
What about other generalized lifestyle and nutritional 3 things you tell patients right off the bat?
I tell them that the harder they apply themselves to work with me on healing their sleep, the easier it's going to be for them to get the weight off and the inflammation down. But also to recognize when you're tired, your brain will drive you towards high-fat, high-calorie foods. So when you're craving those things, ask yourself, how well did I sleep last night? Am I hungry or am I tired? And increasing and making sure you maintain hydration is key as well. It only takes a 2% drop in your hydration to create edema and swelling and all of those things. So the diet, it's bi-directional. I am not of the philosophy that you have sleep apnea because you're overweight. Lose your weight and you'll solve your sleep apnea. I don't approach patients that way. I feel it's very shaming, and I think as healthcare providers, we know the issue's bigger than that. The reason they put on the weight was because they were hungry. The reason they put on the weight is because they're inflamed. So helping to dial back what's led them to this place, and understanding that no person sitting in front of you that's overweight and has low self-esteem about it, or feels bad, or is aware, needs you to add any more shame to that. Let's help them to understand how they got that way and know that their body does not want to be in that state. Their body actually wants to be healthy, agile, feeling like when you wake up in the morning, you're excited to face the day rather than feeling stiff and achy and have trouble moving. That's the approach that I take with patients. When you consider the pillars of health, diet, nutrition, and sleep, if you want to improve one of those pillars, you can start by elevating the other two. And just by elevating those other two, that one gets lifted. So it makes sense if we want to improve our sleep, let's eat a little bit better. Let's move our body a little bit more. We'll sleep better tonight. The opposite is the alternative is true too. If I have a good night's sleep, then I'm going to make better choices. I think that we've spent way too much time and effort obsessed with weight, with diet for weight.
Tell me exactly what you do regarding your coaching, how you set that up, how you do that for people that are listening and watching.
So a few things. I love working with people one-on-one. I have a comprehensive program for that where we have quite a bit of contact with one another, and I can help to retrain, recapture. People are usually surprised, what a dramatic difference a few things can make. And I work with a lot of couples who say their goal is, yes, they go to bed together at night, but they would love to be able to wake up with one another in the morning as opposed to
that's
somebody.
Really good. That's really
Right?
good. I like
Yeah,
that.
so that's a lot of their goals is as simple as that. Or if they've been on medication for sleep and they want to get off and they don't know how, they panic in thinking about how to get off. So I have a one-on-one coaching or a 2-for-1 where I work with the couple, which I like that better because sleep, if you're in a relationship, is a couple's thing. It impacts each other. The other thing I do is I work with different practices who have taken on sleep from whatever their perspective is, but they want to have a deeper knowledge. They want to keep going deeper. So I have programs like, for example, when you look at a patient's medication list, just by looking at those medications, do you understand how this will affect their total sleep time, their ability to get REM or not get REM, how long it's going to take them to fall asleep, when they're going to wake. So people like to know how their medication is impacting them, and we don't often think about those everyday medications people are on, and that can be part of the issue too. So one-on-one coaching or working with providers who just want to keep increasing their knowledge, depth and knowledge of sleep.
Where's the best place to find you?
You can email me and I can put you on our newsletter to share. I love sharing information, and I'm kind of a geek when it comes to all the science that comes out and figuring out what does the science tell us and how do we impact our patients in a practical way with it. I don't like the idea that a study is done that shows dramatic results and it takes 20 years to get to the bedside. I think as the science and knowledge is becoming available, every consumer has the right to know what's out there and what can help them in real time. And so I share that in my newsletter. So I'd be happy to have people join to that. And I want to thank you for giving me the time to talk about something I get so excited about. The time flies. I could talk about this all day long.
You are obviously very motivated, talented, bright. I love your energy regarding putting this, and I love your conversion from what I call a sick care system to actually trying to make a difference on the front end, trying to see if we can keep people from getting to that point over there. So you've just been a wealth of knowledge. I'm super impressed. I'm really glad that you would spend a few minutes. Do you have any last word or two, listeners?
Well, thank you so much for what you're doing too. And I think especially with the clients that you see and the hope that you're able to offer them to feel better. People are tired of feeling tired and feeling like there's something wrong with them and nobody can put their finger on it. So I think that what you're doing is really offering them an explanation, and that provides hope and encouragement about the future. And what more could we do for one another right now, especially, but to offer them a way to stay as healthy as possible, as easily as possible, just by having a great night's sleep.
Well, it's been a privilege talking with you. And again, I'm super impressed. And so I thank you for your time today.
Thank you so much.